I should talk about the three sort of phases of psychedelic work, right? This is kind of psychedelic psychotherapy 101, right? There's three phases. There's what's called the preparation phase, then there's the psychedelic sessions, and then there's something called an integration phase. To do this well, you have to do all three. You can't skip any of those pieces, or you really won't do the work, and you could have a more negative outcome. Preparation is kind of intuitive. It means that you're spending a lot of time with the person before they're on a mind-altering drug, right? So you're getting to know them, they're getting to know you, developing rapport, trust, talking about what's going on, talking about expectations, trying to understand clinically their diagnosis, their symptoms, their presenting complaint, their concerns, what they want to work on, making sure you have a plan, that you're on the same page. So that's the preparation phase. Then you do a psychedelic session. You're sitting with the person while they're on a trip dose, so they're tripping essentially. And you're using that time and that space in a therapeutic way. Then that's over with. Then they go home, they go to sleep. The next day you check on them. And then we usually the next day, sometimes even the same day, depending on what your plan is. But after the trip experience is over, you're doing what's called the integration phase. That can last for quite a while. That can be a session, but it's often multiple sessions. And that's where you're meeting with the person and talking in the sober state about their experience and what it means for their future lived experience when they're not on the drug. So how are they going to incorporate what happened to them into their everyday life going forward? Like, what is it going to mean for them, right? So I had this experience. I had this sort of insight when I was on the psychedelic, or I saw something in a different way. Well, now I'm sober. I don't see those things anymore, but I remember them. What does this all mean? Like, now what? It's like kind of like the now what question. And I think that, so then you start what's called an integration phase. And that's probably the most important part of the work. In fact, when I'm training people, that's what we do the most supervision and training around, honestly. Like, you would think you would do a lot of training around the psychedelic session itself, but I think the integration is way more of a specialized skill set. Like, so that's where the expertise really comes in, is understanding how to pull pieces of that experience out into their sober life in the everyday world in a way that is healing or creates change or creates benefit. So that can be anywhere from one session to quite a few, depending on what your plan is with this person. And then that whole cycle repeats again if they're going to do it a second or third time. It really depends on the person in that case.